Metabolic syndrome, preventing the health crisis of our time. A comprehensive guide to understanding, managing, and overcoming the growing epidemic. In an age where convenience often trumps health, metabolic syndrome has emerged as one of the most pressing health crises of our time. Affecting millions worldwide, this cluster of conditions, including obesity, high blood pressure, and insulin resistance, poses significant risks to our well-being, increasing the likelihood of heart disease, diabetes, and stroke. As the modern lifestyle continues to evolve, so too does the urgency to understand and combat this growing epidemic. In this comprehensive guide, we will delve into the intricacies of metabolic syndrome, exploring its causes, symptoms, and risk factors, while equipping you with practical strategies for prevention and management. By empowering ourselves with knowledge and actionable insights, we can take proactive steps toward a healthier future, transforming this alarming trend into an opportunity for better health and well-being for all. Join us as we navigate the complexities of metabolic syndrome and discover how to reclaim control over our health in this critical journey toward wellness. Metabolic syndrome, an overview. Metabolic syndrome is increasingly being recognized as a significant health crisis of our time, impacting millions across the globe. This complex cluster of conditions, characterized by increased blood pressure, elevated blood sugar levels, excess body fat around the waist, and abnormal cholesterol levels, poses a severe risk for heart disease, stroke, and diabetes. The alarming rise of metabolic syndrome can be attributed to a combination of sedentary lifestyles, poor dietary choices, and growing levels of stress, all exacerbated by the modern environment in which we live. Understanding metabolic syndrome is crucial, as it often goes unnoticed until it leads to more severe health complications. Many individuals may not even realize they are affected until a routine checkup reveals concerning metrics. The syndrome is not simply a singular health issue but rather a signal of the overall metabolic dysfunction that can affect multiple bodily systems. It serves as a warning bell for the urgent need to reassess lifestyle choices and prioritize health. In this comprehensive guide, we will delve deeper into the intricacies of metabolic syndrome, exploring its risk factors, symptoms, and the underlying mechanisms that contribute to its development. We will also discuss preventative strategies and management techniques that can empower individuals to take control of their health, make informed decisions, and ultimately overcome this growing epidemic. By raising awareness and understanding the multifaceted nature of metabolic syndrome, we can work together to foster healthier communities and curb the trajectory of this health crisis. Understanding the components of metabolic syndrome. Understanding the components of metabolic syndrome is crucial for grasping the full scope of this complex health issue. Metabolic syndrome is not a single disease but rather a cluster of conditions that together increase the risk of heart disease, stroke, and diabetes. By recognizing these components, individuals can take proactive steps toward prevention and management. The primary components of metabolic syndrome include 1. Abdominal obesity, often referred to as visceral fat. This type of fat is stored around the abdomen, and is a significant risk factor for metabolic syndrome. Measuring waist circumference can provide insight into whether you fall into the category of abdominal obesity. Generally, a waist measurement of over 40 inches in men, and over 35 inches in women is considered a risk factor. 2. High blood pressure. Elevated blood pressure is another critical element of metabolic syndrome. When the force of blood against the artery walls is consistently too high, it can lead to serious health complications. A reading of 130/85 of a millimeter of mercury or higher is typically indicative of hypertension. 3. Elevated blood sugar levels. Having insulin resistance or prediabetes can signal the onset of metabolic syndrome. A fasting blood sugar level of 100 mg/dL or higher suggests that the body is struggling to manage glucose effectively, setting the stage for future complications. 4. Abnormal cholesterol levels, lipid profiles that reveal high triglycerides, 150 mg/dL or higher, and low levels of high-density lipoprotein, HDL, cholesterol, often referred to as good cholesterol, are additional indicators. A low HDL level, less than 40 mg/dL in men and 50 mg/dL in women, can further elevate the risk. Recognizing these components is the first step in a journey toward better health. Understanding how they interconnect can empower individuals to make informed lifestyle choices, such as adopting a balanced diet, engaging in regular physical activity, and managing stress. As we delve deeper into the causes and impacts of metabolic syndrome, it becomes evident that awareness and education are key tools in preventing this health crisis of our time. The growing prevalence, statistics and trends. In recent years, the alarming rise in metabolic syndrome has become a pressing public health concern, with statistics reflecting a trend that cannot be ignored. According to the Centers for Disease Control and Prevention, CDC, the prevalence of metabolic syndrome among adults in the United States has surged dramatically, impacting nearly 50 million individuals. This means that approximately 1 in 3 adults are now classified as having this condition, a stark increase from previous decades. Globally, the figures are equally concerning. The World Health Organization, WHO, reports that metabolic syndrome is becoming more prevalent in developing countries, mirroring the trends observed in industrialized nations. Factors such as urbanization, dietary shifts towards processed foods, and a more sedentary lifestyle are contributing to this epidemic. Moreover, age plays a significant role in the prevalence of metabolic syndrome. Research indicates that the likelihood of developing this condition increases significantly with age, with adults over 60 being particularly at risk. However, it's increasingly common to see younger populations affected, including adolescents and young adults, due to rising obesity rates and lifestyle changes. The trends are not merely numbers, they represent individuals facing a higher risk of serious health issues, including cardiovascular disease, diabetes, and stroke. Understanding these statistics is crucial for fostering awareness and driving action towards prevention. As we delve deeper into the implications of metabolic syndrome, it becomes clear that addressing this health crisis requires collective effort, informed decision-making, and a commitment to healthier lifestyles. It's not just about numbers, it's about lives affected and the future we can shape together. Risk factors: what increases your chances? Understanding the risk factors associated with metabolic syndrome is crucial for both prevention and management. Metabolic syndrome is not a single condition but rather a cluster of health issues that significantly elevate the risk of heart disease, stroke, and type 2 diabetes. By identifying these risk factors, you can take proactive steps to mitigate your chances of developing this serious health concern. 1. Obesity. Perhaps the most significant risk factor is excessive body fat, particularly around the abdomen. This visceral fat is not just a cosmetic issue, it produces hormones and substances that can lead to inflammation and insulin resistance, both key components of metabolic syndrome. 2. Sedentary lifestyle. Regular physical activity is essential for maintaining a healthy weight and metabolic function. A lack of exercise can contribute to obesity, and negatively impact insulin sensitivity. Incorporating even small amounts of physical activity into your daily routine can make a profound difference. 3. Unhealthy diet. A diet high in refined carbohydrates, sugars, and unhealthy fats can increase your risk. Consuming processed foods, sugary drinks, and snacks can lead to weight gain and elevated blood sugar levels. Conversely, a diet rich in whole foods, including fruits, vegetables, lean proteins, and healthy fats, can help lower your risk. 4. Age. As we get older, our risk for metabolic syndrome naturally increases. Hormonal changes, decreased muscle mass, and a slowing metabolism all contribute to this heightened risk. It becomes increasingly important to adopt healthy lifestyle habits as we age. 5. Genetics. Family history plays a significant role in your likelihood of developing metabolic syndrome. If you have parents or siblings with conditions such as obesity, type 2 diabetes, or cardiovascular disease, your risk may be elevated. While you can't change your genetics, awareness allows you to be more vigilant about your health choices. 6. Sleep disorders. Conditions such as sleep apnea can disrupt your sleep quality, leading to increased fatigue, and a higher likelihood of weight gain. Poor sleep is also associated with insulin resistance and elevated blood pressure, both of which are components of metabolic syndrome. 7. Stress. Chronic stress can lead to unhealthy coping mechanisms, such as overeating or sedentary behavior. It also triggers the release of hormones like cortisol, which can contribute to weight gain, particularly around the abdomen. Managing stress through mindfulness practices, exercise, or relaxation techniques can help reduce this risk. Recognizing these risk factors is the first step toward taking control of your health. By making informed lifestyle choices and seeking support when needed, you can greatly decrease your chances of developing metabolic syndrome and pave the way for a healthier future. The connection between metabolic syndrome and chronic diseases. Metabolic syndrome is not merely a standalone condition, it serves as a crucial indicator of a broader health crisis, linking directly to a range of chronic diseases that affect millions worldwide. Characterized by a cluster of risk factors, including obesity, high blood pressure, elevated blood sugar levels, and abnormal cholesterol levels, metabolic syndrome dramatically increases the likelihood of developing serious health issues such as type 2 diabetes, cardiovascular disease, and even certain types of cancer. Understanding this connection is vital for both prevention and management. When the body's metabolism becomes unbalanced due to the excess fat, especially around the abdomen, it can lead to inflammation and insulin resistance. This, in turn, creates a perfect storm for the development of chronic diseases. For instance, individuals with metabolic syndrome are 2 to 3 times more likely to develop type 2 diabetes, as their bodies struggle to regulate blood sugar levels effectively. Moreover, the cardiovascular implications are profound. The risk of heart disease skyrockets, as the combination of high blood pressure, elevated triglycerides, and low HDL cholesterol creates a perfect environment for arterial plaque buildup. This can lead to atherosclerosis, heart attacks, and strokes, making it imperative to recognize and address metabolic syndrome early on. Beyond these immediate concerns, the long-term effects of metabolic syndrome can also contribute to conditions like fatty liver disease and polycystic ovary syndrome, PCOS, further complicating one's health landscape. Thus, addressing metabolic syndrome isn't just about managing weight or improving diet, it's about taking proactive steps to prevent a cascade of chronic diseases that could drastically alter the quality of life. By understanding the intricate connections between metabolic syndrome and these chronic diseases, individuals can take charge of their health through lifestyle changes, early intervention, and regular medical checkups. Knowledge is power, and recognizing the signs and symptoms of metabolic syndrome can empower individuals to make informed decisions that lead to healthier, longer lives. As we continue to navigate this modern health crisis, the imperative to confront metabolic syndrome becomes clearer than ever. Recognizing the symptoms, early warning signs. Recognizing the symptoms of metabolic syndrome is crucial for early intervention and prevention of more serious health issues down the line. This cluster of conditions often develops silently, making awareness of the warning signs even more vital. One of the primary indicators to watch for is an increase in abdominal fat. If you notice a sudden change in your waist circumference, more than 40 inches in men and 35 inches in women, this could be a red flag. Alongside this, fluctuations in blood pressure can signal trouble. Consistent readings of 130/85 of a millimeter of mercury or higher warrant concern. Dyslipidemia is another key symptom to keep an eye on. Elevated triglyceride levels, specifically those above 150 mg/dl, can indicate that your body is struggling with fat metabolism. Conversely, low levels of HDL, the good cholesterol, less than 40 mg/dl in men and 50 mg/dl in women, can also be a warning sign of metabolic imbalance. Furthermore, insulin resistance often presents itself through frequent cravings for sugary foods, fatigue after meals, or a sudden increase in weight, particularly around the abdomen. These symptoms indicate that your body is not effectively using insulin, a condition that can escalate to type 2 diabetes if left unchecked. Lastly, don't overlook the subtle changes in your overall health. Persistent fatigue, difficulty concentrating, and mood swings can be linked to metabolic syndrome's underlying issues. Being attuned to your body and recognizing these symptoms is the first step in taking control of your health. By understanding these early warning signs, you can empower yourself to seek medical advice, make lifestyle changes, and ultimately prevent the progression of metabolic syndrome into more serious health problems. Remember, awareness is the cornerstone of prevention. Lifestyle changes for prevention, diet and nutrition. When it comes to preventing metabolic syndrome, diet and nutrition are your first lines of defense. The foods you choose to nourish your body can either bolster your health or contribute to chronic conditions such as obesity, hypertension, and insulin resistance, all key components of metabolic syndrome. To kickstart your journey towards better health, focus on incorporating a variety of whole, nutrient-dense foods into your daily meals. Embrace a colorful plate filled with fresh fruits and vegetables, which are rich in vitamins, minerals, and antioxidants that combat inflammation and protect against disease. Aim for at least 5 servings of fruits and vegetables each day. Think leafy greens for salads, berries for breakfast, and vibrant peppers for snacking. Whole grains should also be a staple in your diet. Swapping refined grains for whole grains like quinoa, brown rice, and oats can help regulate blood sugar levels, improve digestion, and keep you feeling fuller longer. These fiber-rich options not only support weight management but also contribute to heart health by lowering cholesterol levels. Protein is another critical element in a balanced diet. Opt for lean sources, such as fish, poultry, beans, and legumes. These proteins provide essential amino acids without the added saturated fats found in red and processed meats. Moreover, consider incorporating healthy fats from avocados, nuts, seeds, and olive oil, which can improve cholesterol levels and support overall cardiovascular health. Be mindful of sugar and salt intake as well. Processed foods often contain hidden sugars and excessive salt, which can exacerbate health issues. Instead, try cooking at home more often to control the ingredients in your meals, and experiment with herbs and spices for flavor without the added sodium. Lastly, stay hydrated. Drinking plenty of water throughout the day is vital for maintaining metabolic functions and supporting overall health. If you find plain water boring, infuse it with slices of fruits or herbs for a refreshing twist. By making these conscious dietary choices, you pave the way for a healthier lifestyle that not only helps prevent metabolic syndrome, but also enhances your overall well-being. Remember, small, sustainable changes can lead to significant, long-lasting improvements in your health. Start today, and take charge of your future. The role of physical activity in managing metabolic syndrome. Physical activity plays a pivotal role in managing metabolic syndrome, acting as a cornerstone for both prevention and treatment of this growing health crisis. Engaging in regular exercise not only helps to reduce the risk factors associated with metabolic syndrome, such as obesity, high blood pressure, and abnormal cholesterol levels, but also fosters an overall sense of well-being that enhances both physical and mental health. When we talk about physical activity, it's important to recognize that it encompasses a wide range of activities, from structured exercise routines like jogging, cycling, and swimming to more everyday movements such as walking, gardening, or even playing with children. The key is consistency. Aiming for at least 150 minutes of moderate intensity aerobic activity each week can significantly improve your body's metabolic function. One of the primary benefits of physical activity is its ability to help regulate insulin sensitivity. Regular exercise encourages the muscles to utilize glucose more efficiently, reducing blood sugar levels and diminishing the risk of type 2 diabetes, a major component of metabolic syndrome. Additionally, exercise promotes weight loss or maintenance by burning calories and building lean muscle mass, which can further enhance metabolic rate. Moreover, physical activity is instrumental in reducing stress, a common contributor to metabolic syndrome. Engaging in exercises like yoga or Tai Chi can promote relaxation and mindfulness, ultimately leading to better emotional health. This holistic approach not only addresses the physical symptoms of metabolic syndrome, but also tackles the psychological barriers that often accompany it. Incorporating strength training into your routine is also crucial. Building muscle can improve your body's composition and increase resting metabolic rate, making it easier to maintain a healthy weight. Aim for strength training exercises at least twice a week, focusing on all major muscle groups. Ultimately, the role of physical activity in managing metabolic syndrome cannot be overstated. It is a powerful tool that, when combined with a balanced diet and other lifestyle changes, can lead to significant improvements in health outcomes. By making movement a regular part of your life, you can take proactive steps to combat metabolic syndrome and pave the way for a healthier future. Stress management techniques for better health. Stress management plays a crucial role in mitigating the risks associated with metabolic syndrome. The interplay between stress and our physical health is profound. Chronic stress can lead to hormonal imbalances, unhealthy eating habits, and a sedentary lifestyle, all of which can exacerbate the symptoms of metabolic syndrome. Therefore, incorporating effective stress management techniques into your daily routine can significantly improve your overall health and well-being. One of the most effective ways to combat stress is through mindfulness practices, such as meditation and deep breathing exercises. These techniques help center your thoughts, reduce anxiety, and promote a sense of calm. Even just a few minutes of focused breathing can trigger the body's relaxation response, lowering cortisol levels and improving metabolic function. Physical activity also serves as a powerful stress reliever. Engaging in regular exercise not only boosts your mood by releasing endorphins but also helps regulate blood sugar levels and improves insulin sensitivity. Whether it's a brisk walk, yoga session, or a high-intensity workout, finding an activity you enjoy will make it easier to stick with it and reap the benefits. Additionally, establishing a strong support system can help alleviate stress. Surrounding yourself with friends, family, or even support groups allows you to share your experiences and challenges, fostering a sense of community and understanding. This social interaction can be a tremendous buffer against stress, helping you navigate the ups and downs of managing metabolic syndrome. Lastly, don't underestimate the power of a balanced lifestyle. Prioritize self-care by ensuring you get enough sleep, maintain a nutritious diet, and allocate time for relaxation and hobbies. By taking a holistic approach to stress management, you can enhance your resilience against metabolic syndrome and foster a healthier, more balanced life. Remember, managing stress is not just about finding immediate relief but cultivating habits that support long-term health and well-being. The importance of regular health screenings. In the battle against metabolic syndrome, regular health screenings serve as an invaluable ally. These proactive checkups are not merely a routine, they are a crucial component of a comprehensive health strategy that empowers individuals to take control of their well-being. By monitoring key indicators such as blood pressure, cholesterol levels, blood glucose, and waist circumference, health screenings provide critical insights into one's metabolic status. The early detection of any abnormalities can be the difference between managing a condition effectively and facing serious health complications down the line. For instance, a simple blood test can reveal elevated glucose levels, serving as an early warning sign for prediabetes or type 2 diabetes, conditions often associated with metabolic syndrome. Similarly, tracking cholesterol can help identify risks for cardiovascular issues before they escalate into more severe health crises. Beyond the numbers, regular screenings foster a dialogue between individuals and healthcare providers. These conversations can illuminate lifestyle factors that contribute to metabolic syndrome, such as poor diet and lack of physical activity, and encourage patients to adopt healthier habits. Moreover, frequent checkups can reinforce accountability, motivating individuals to stick to their health goals and make informed decisions. It's also worth noting that the frequency of screenings may vary depending on individual risk factors, such as family history, age, and existing health conditions. While the general guideline suggests annual checkups for most adults, those at higher risk may benefit from more frequent evaluations. In a world where metabolic syndrome is becoming increasingly prevalent, the importance of regular health screenings cannot be overstated. They are the first line of defense, enabling early intervention and guiding individuals toward a healthier, more informed lifestyle. By prioritizing these screenings, individuals can enhance their understanding of their health, mitigate risks, and take proactive steps toward overcoming the growing epidemic of metabolic syndrome. Medications and treatments, what you should know. When it comes to managing metabolic syndrome, understanding the role of medications and treatments is crucial for effectively navigating this complex health issue. While lifestyle modifications, such as adopting a balanced diet, engaging in regular physical activity, and managing stress, are foundational to prevention and management, there are instances where pharmacological interventions may become necessary. Medications prescribed for metabolic syndrome often focus on addressing its individual components, such as high blood pressure, elevated cholesterol levels, and insulin resistance. Common classes of medications include statins, which help lower cholesterol, antihypertensives to manage blood pressure, and antidiabetic medications like metformin, which can improve insulin sensitivity. It's essential to work closely with a healthcare provider to determine the most appropriate treatment plan tailored to your specific health needs and conditions. In addition to traditional medications, there are also emerging treatments and lifestyle medications aimed at addressing obesity, a key factor in metabolic syndrome. These include newer classes of medications like GLP-1 receptor agonists, which not only aid in weight loss but also provide cardiovascular benefits. However, it's important to discuss the potential risks and benefits of these options thoroughly with your healthcare provider. As with any health regimen, regular monitoring is vital. This may involve periodic assessments of blood pressure, cholesterol, and blood glucose levels to gauge the effectiveness of treatments and make necessary adjustments. Moreover, it's beneficial to stay informed about the latest research and advancements in metabolic syndrome management, as the field is continually evolving. Ultimately, while medications can be an essential component of treatment, they should not replace the foundational changes that promote overall health. Combining pharmacotherapy with sustainable lifestyle adjustments is key to effectively managing metabolic syndrome and reducing the risk of related health complications. By staying informed and proactive, individuals can take significant steps toward overcoming this growing epidemic and achieving long-term health. Creating a support system, role of family and friends. Creating a support system is essential in the journey to manage and overcome metabolic syndrome. While individual efforts are crucial, having the backing of family and friends can significantly enhance your commitment to healthier lifestyle choices. The emotional, mental, and social aspects of managing metabolic syndrome often carry as much weight as the physical changes you aim to achieve. Your family and friends can provide encouragement when motivation wanes, celebrating your milestones and progress along the way. They can help you stay accountable, whether it's by joining you in exercise routines or participating in meal prep sessions. When those around you share your goals, such as adopting a balanced diet, engaging in physical activity, or simply being more mindful about health, you're more likely to stick with it. Moreover, discussing your challenges with loved ones can alleviate feelings of isolation or frustration that often accompany health struggles. A supportive network can lend an empathetic ear, offering advice or simply a comforting word when you face setbacks. Sharing your journey with others can also inspire them to prioritize their health, creating a ripple effect that benefits everyone involved. To foster this support, consider involving your family and friends in your health journey actively. Host regular family dinners where everyone contributes healthy dishes, or organize group walks or fitness classes that encourage participation. By making health a group effort, you not only strengthen your relationships but also solidify your commitment to overcoming metabolic syndrome together. Remember, you're not just fighting this battle alone. Leaning on your support system can make all the difference in navigating the complexities of this health crisis. Resources for further learning and support. In the quest to understand and combat metabolic syndrome, equipping yourself with the right resources is essential. Knowledge is power, and having access to comprehensive information can empower you to make informed decisions about your health. Below, we've compiled a list of valuable resources for further learning and support that can aid you on your journey toward better health. Books and literature. Dive into authoritative texts that provide in-depth knowledge about metabolic syndrome, its causes, and management strategies. Titles such as The Metabolic Syndrome, A Comprehensive Guide to Understanding and Managing Your Health offer insights from leading health professionals and researchers. Additionally, consider exploring cookbooks that focus on heart-healthy and low-sugar recipes to support your dietary changes. Online courses and webinars. Many organizations, including the American Heart Association and the National Institutes of Health, offer free or low-cost online courses and webinars. These sessions cover topics such as nutrition, exercise, and stress management, providing you with practical tools to integrate into your daily life. Support groups and forums. Connecting with others who are navigating the challenges of metabolic syndrome can provide a sense of community and encouragement. Look for local support groups or online forums where you can share experiences, ask questions and gain motivation from fellow members. Websites like Meetup or Facebook groups can be excellent starting points to find others on a similar journey. Health apps and tools. There are numerous mobile applications designed to help individuals track their health metrics, such as blood sugar levels, blood pressure, and physical activity. Apps like MyFitnessPal or Fitbit can assist you in maintaining a healthy lifestyle by monitoring your progress and keeping you accountable. Professional support. Consulting with healthcare professionals, such as registered dietitians, endocrinologists, or certified health coaches, can provide personalized guidance tailored to your unique situation. These experts can help you develop a sustainable plan to manage your weight, improve your metabolic health, and reduce your risk of developing further complications. Podcasts and YouTube channels. For those who prefer audiovisual learning, there are numerous podcasts and YouTube channels dedicated to health and wellness topics, including this one. Listening to experts discuss metabolic syndrome, share success stories, and offer practical advice can be both informative and inspiring. By taking advantage of these resources, you'll be better equipped to understand metabolic syndrome and the lifestyle changes necessary to manage it effectively. Remember, the journey toward better health is a marathon, not a sprint, and seeking knowledge and support is a crucial step in overcoming this growing health crisis. Conclusion: taking action against metabolic syndrome. As we reach the conclusion of this comprehensive guide on metabolic syndrome, it's essential to recognize that understanding and managing this condition is not just a personal journey, it's a collective responsibility that impacts our communities and healthcare systems. Metabolic syndrome represents a growing epidemic that, if left unchecked, poses serious risks not only to individual health but also to public health as a whole. Taking action against metabolic syndrome begins with awareness. Education plays a pivotal role in recognizing the risk factors, such as obesity, hypertension, high blood sugar, and abnormal cholesterol levels, and understanding their interconnectedness. By acknowledging these risks, individuals can make informed choices about their lifestyle and seek necessary medical guidance. Implementing preventive measures is equally crucial. This means adopting a balanced diet rich in whole foods, engaging in regular physical activity, maintaining a healthy weight, and monitoring metabolic indicators. These changes may seem daunting, but small, consistent actions can lead to significant improvements over time. Forming support networks, whether through friends, family, or community groups, can bolster motivation and accountability, making the journey toward better health less isolating. Moreover, healthcare professionals must prioritize screening for metabolic syndrome and its components during routine checkups, empowering patients to take charge of their health proactively. Additionally, advocating for policies that promote healthier environments, such as improved access to nutritious foods, safe spaces for physical activity, and educational programs, can lead to a broader societal shift in combating this crisis. In conclusion, the fight against metabolic syndrome is not merely about individual choices but also about fostering a community that prioritizes health and well-being. By taking action, educating ourselves, supporting one another, and advocating for systemic changes, we can mitigate the effects of this silent epidemic and pave the way for a healthier future for ourselves and generations to come. Together, we can turn the tide on metabolic syndrome and reclaim our health.